Welcome to the panel on providing linguistically responsive services in New York State. I am Alejandro Cintron, the Deputy Director for the New York State Office of Language Access within the Office of General Services, or OGS for short. This session will promote the Language Access Law and the fact that the OGS Centralized Backdrop Language Services Contract is available for government agencies, localities, and also certain nonprofit organizations, as expressly noted in the New York State law. And we want to highlight that availability for certain nonprofit organizations, as this can be such a helpful resource. During the session, we will explore the different authorized user perspectives from our panelists, including the applicability of the wide array of services under the contract, benefits of buying from this contract, and the process to become an authorized user. Now, it's my honor to introduce our amazing panelists. To my left, we have Melissa R. Quesada, Esquire. She is the Chief Diversity, Equity, Inclusion, and Access, or DEIA, Officer at the New York State Department of Labor. In her role, she manages several key departments, including the Office of Language Access. Next, we have Jeanette M. Rondo. She is the Director of Diversity and Inclusion at the Office of Justice, Equity, Diversity, and Inclusion within the New York State Office of Addiction Services and Supports, known as OASIS. She also serves as the Agency Language Access Coordinator and the Minority Women-Owned Businesses Liaison. Next, we have Jenny Munoz. She is a Senior Manager for Policy and Strategic Partnerships at the New York State Office for New Americans and a Deputy Language Access Coordinator for the New York Department of State. And then we have Laura Dempsey. She is the Contract Management Specialist 1 in the Procurement Services within OGS. And Laura has been the contract manager of the Language Services Contract Award, which we're discussing today, number 23253, since inception. Then we have Carol Pilko. She is the manager in the purchasing unit of the OGS Business Services Center, or BSC. Carol has worked with the language services contracts for the past 7 years. Under the most recent contract, she and her teams have conducted over 500 requests for quotes, commonly referred to as RFQs, in addition to reviewing and processing all resulting purchase orders. So with the introduction to the panelists, we will begin with some panelist questions before opening up to questions from the audience. First question we have is for Carol. Why would an office need to use these services?
Basically, it boils down to two different laws. The first is the Language Access Law. It was originally an executive order issued by Governor Cuomo, and then it was expanded into law by Governor Hochul. And it basically requires four things. First, it requires that any state agency that provides direct public service in New York must translate all vital documents into the 12 most common non-English languages spoken in the state. Secondly, each agency must designate a language access coordinator to ensure compliance. Third, each agency must develop a language access plan, which is submitted to OGS. Fourth, agencies must provide interpretation services between the agency and an individual in each individual's primary language with respect to the services being provided. So that's the reason that we would actually have to provide said services. And then state finance law is what dictates how you actually procure those services. It sets the order of precedence, which is normally preferred sources first. The preferred sources at this point, NYS, PSP, and NYSID, they do not currently offer interpretation or translation services. So then the next order of precedent would be OGS or statewide contracts. And that's where the language services contract comes in. Most state agencies would use this contract unless it doesn't meet your form, function, and utility. And Laura and her colleagues at OGS Procurement Services did most of the legwork for the main contract itself, so that all that's really left for agencies and other users to do is to solicit vendors and get pricing that is reflective of your specific need. You want to reach out to your language access coordinator, looping back into the first law, to find out what your specific needs are, because they vary greatly by agency. One agency may need over the phone because you've got a call center and you're taking all sorts of phone things. If you're doing a presentation, you may need American Sign Language interpreters. Some things are pre-scheduled, some things are as needed. You may have a patient that comes into a residential facility and does not speak English. So that might be an immediate, unexpected need that you would use this contract to find interpreters for that. If you happen to be a BSC finance customer, the BSC can actually do the solicitations, the RFQs, on your behalf. We've done a lot of them. So we've refined the whole process so we can do that for you. Other agencies that are not customers, if you've got questions, you can always reach out.
Great, thank you, Carol. The next question we have is for Laura. What are the steps nonprofits, schools, local government can take to become an authorized user?
Eligible nonprofits, whether it's schools, local governments, et cetera, they would need to submit an application for the New York State contract extension program to the OGS Procurement Services Customer Services in order to be approved as an authorized user of the New York State centralized contracts. The application forms are available on the OGS procurement website, and entities can reach out to customer services, and then customer services can provide further assistance. And once it's approved, the entity in question will be assigned an OGS authorized user ID number. New York State defines an authorized user in state finance law, section 1631K, and it includes but is not limited to New York State agencies, political subdivisions, local governments, public authorities, public school and fire districts, public and nonprofit libraries, and certain other non-public or nonprofit organizations. Not all nonprofits are eligible to use the centralized contract portfolio. Use of the centralized contracts is open to those nonprofit organization types expressly noted in the laws of New York, primarily under the New York State finance and general municipal laws. The types of eligible nonprofit organizations include, but are not limited to, nonprofit, non-public elementary or secondary schools, nonprofit, non-public hospitals, residential health care or mental hygiene facilities, and also nonprofit charter schools as well. An additional category involving nonprofit entities is that of charitable organizations. In addition to the simple application form, these entities are required to submit a certification form to assist in determining their eligibility under the law. These organizations are admitted to the program in accordance with Chapter 751 of the laws of 1985, which was last amended by Chapter 55 of the laws of 2012. Applications, including the charity certification, are available on the OGS Procurement Services website. OGS Procurement Customer Services can also advise as to whether or not any specific entity is currently registered within the program, and Customer Services can also provide assistance to any entities who are seeking to apply as well.
Great, thank you for that list and those examples and that information, Laura. The following question is for Jenny and Jeanette. Jenny, we'll start with you, then Jeanette. Which services under this contract do you use the most and how?
I work at the Department of State, and we are a very big agency with a lot of different offices with distinct missions. Just to name a few that I will discuss today, we have the Athletic Commission. We regulate boxing and MMA matches. We have the Division of Licensing. We provide licenses for nail salons, barber shops, security guards, and we have administrative hearings regarding disciplinary complaints for licensees. And I work for the Office for New Americans, so we support through the Office for New Americans community-based organizations across the state that deliver direct services to immigrants so that they can integrate civically and socially within the fabric of our state. So regarding to the question, what services under this contract do we use the most and how? I looked back at our report. We have to do a report every year about the services that we used. Written translation is the service that our agency uses the most. We have 125 forms and publications that enable access to a service or a benefit. So that's how we identify a former publication that should be translated is that it enables access to either a service or a benefit from our agency. We also translate email communications received by constituents in other languages. We translate licensing exams upon request into languages beyond the 12. We recently received a request for a language beyond the 12. PowerPoint presentations. Our Office for New Americans has dedicated outreach staff that are in the community, and they use interpreters to make sure that their presentations are made available to distinct communities across the state. And we also translate vital documents submitted by constituents to access a benefit or service. And for our agency, that could be a birth certificate, it could be a diploma that a licensee is using to, or someone is using to procure a license from the Division of Licensing, for example. And how do we do this? We have a dedicated SharePoint site, and all of our offices are trained on how to access the SharePoint site to request services. We are a really big agency, and we can't be physically in every division to provide guidance, so we have a liaison model where we work with each division director to identify a liaison or two, and we train them on the importance of language access, on how to use our services, on how to report deficiencies. So we have a language access team, so it's myself as deputy, our language access coordinator, an assistant that we process requests directly with the vendor. And so staff would go to the SharePoint site, submit a request through something simple like a Microsoft Forms, and then that would come back to us to submit a formal request. And our second most utilized service at the Department of State is in-person interpretation. We provide in-person interpreters for boxing and MMA matches regulated by the Athletic Commission. We also provide in-person interpreters for outreach presentations organized by the New York State Office for New Americans, for example. And again, it's the liaison model that allows us to have communication on how to use our services and how we can enhance service delivery in case there's any troubleshooting that needs to occur, in case more guidance needs to be given to our interpreters or to our vendors. And I'll give an example. So we have a liaison for the Athletic Commission. Her name is Anna, and she submits requests for interpreters for boxing and MMA matches where the combatants may have a limited English proficiency. They may be coming from abroad, participating in an MMA bout, and may require interpretation following the bout during the physical examination and throughout the match or weigh-in. So our liaison provides the interpreters with an overview of the rules and responsibilities of interpreters during a boxing or MMA weigh-in, and then for the actual boxing and MMA event. And as you can imagine, there are very specific guidance that has to be communicated to the interpreters about these events. And it's communicated with the vendor, but the liaison needs to ensure that the interpreter knows and understands those rules and responsibilities. The liaison reports to us, the Language Access Coordinator team, any issues encountered, and then we communicate back with the vendor. So for us, how we do it is really through communication. If I could sum it up in one word, it's communicating with division directors, having them assign liaisons, and then training those liaisons on best practices with language services, working with interpreters, and seeing how we can respond to their needs. So those are two things that we can share: our dedicated language access SharePoint site to request services and our language access liaison model.
I'm going to start just the New York State Office of Addiction Services and Supports oversees one of the nation's largest substance use disorder systems of care, with approximately 1,700 prevention, treatment, and recovery programs and harm reduction, serving over 730,000 individuals per year. This includes the direct operation of 12 addiction treatment centers, where our doctors, nurses, and clinical staff provide inpatient and residential services to approximately 8,000 individuals per year. OASIS is the single designated state agency responsible for the coordination of state-federal relations in the area of addiction services. Our mission is to provide, support, and oversee a data-driven continuum of addiction services delivered with equity, dignity, compassion, and respect. So I would say that the services that we most use, so our 12 addiction treatment centers are our state facilities. And my state facilities tend to use over-the-phone interpretation and in person. So right now for our over-the-phone, we have AdvanPage, which are wonderful. And for in person, we use Language Today. Also, we've used Language Line and Geneva. Always going to give our vendors a shout out. They've done great work with us. So our over the phone has actually increased since the pandemic. I know a lot of you may be aware, there have been, at that time during the pandemic, an increase in overdose deaths. There's been a slight decrease in this past year, but at the time during the pandemic, we definitely saw an increase in over the phone and in-person need for interpreters, which I see as a positive thing because that means that we're reaching more vulnerable populations who speak different languages and also American Sign Language to get the treatment that they deserve. So as it pertains to written translation, as I mentioned, Erickson is our new vendor. We've translated over 30 vital documents, working with these vendors who understand language access, understand cultural competence, understand that we are serving the most vulnerable population is extremely important. We do have the top 10 languages available for information on our website alongside our vital documents. So you can go on our website and kind of click on the language that you need. I also provided a LAC training, a language access training. So I'm now going to pivot to, we have over 930 providers. And our providers basically are required, we have a language access bulletin on our language access webpage that spells out what the federal law requires of them because they receive federal funding. So at their own cost, they have to provide language access services to anybody that comes into their programs. So I provided a training for our providers through our Learning Thursday series, which allows our providers to get both KSAC and social work credits, So you're being trained and you're also getting accreditation at the same time. So we also have our 24/7 confidential and free Hope Line, which uses Language Line as their interpreter vendor. And what the Hope Line does is anyone who needs to find treatment, you call the Hope Line, you give them your zip code. Again, you're anonymous, it's confidential. We also do texting. And they do have some bilingual staff within the Hope Line. But as I mentioned, they utilize Language Line for, staff that they may not have to translate into other languages. So as I mentioned, I'm very encouraged that we have had an increase in over the phone. Written translation will continue to grow as we do campaigns and want to educate and create awareness to the public of, the different substances, including still alcohol. Alcohol is still number one drug, to further help them get the services that they need for addiction. I also want to, thank Ole because one of the things that they were able to help us do is that our programs who receive state funding can utilize the OGS state rate and can utilize the OGS preferred list, which I included in our training. So I'm very grateful for their assistance and support to help our providers, meet a cost that we know is costly, but it's needed.
Great. Thank you both for sharing your experiences with the contract from your agencies. The next question we have is for Melissa. What changes have you seen in the provision of your organization's services since you began buying services of this contract?
So I'll start off, Alejandro, by just giving a little bit of background about the Department of Labor. The Department of Labor services upwards of 500,000 customers a year. We have over 90 offices that are throughout the state, located in every region of the state. We have really seen, I would say, a marked difference in our ability to provide services to all of our customers, both in person, online, over the phone, and whether that be through telephonic services, written materials, or simultaneous and translations and interpretation. I think there's a few areas that really we've seen it. Improved accessibility for individuals is one. Enhanced ability to serve a more diverse population of people, an increase in our ability to do outreach. The Department of Labor is responsible for a lot of compliance related to public works, as well as to wage and hour and labor related issues. And also we go out and we visit farms as well, and we're working with communities that oftentimes, and individuals who can have limited English proficiency, and utilizing these contracts has really enabled us to be able to do better outreach and to communicate with people in a better way. And then greater flexibility also in being able to meet the diverse language needs across the state. In terms of improved accessibility, we've really seen a marked difference in our unemployment insurance division, specifically in our call centers. We are able to offer telephonic interpretation in 179 different languages, which has really been, increased the agency's ability to service a wider array of individuals and to provide meaningful and culturally competent, culturally linguistic services. And our career centers, we've implemented language line services and working, with our contractors, which has really allowed our staff to be able to serve customers in their preferred language, and to really meet customers where they are and where they feel the most comfortable, and communicate with them in a way that they feel comfortable. In our provision of services online, our website is currently available in 12 languages. We translate all of our written documents into the mandatory 12 languages, and an additional 4 for a total of 16. We offer interpretation services both at our career centers, job fairs, hearings, as well as any outreach that happens, like I mentioned earlier, some of the outreach that we do on farms, or at different sites, or when we go into a job site, if we're doing a wage and hour investigation, we're able to use on-site interpretation services. That's done in 39 languages, which has really increased our ability to communicate with people. Again, our increased outreach that we're able to do, conducting multilingual social media campaigns. It used to be that people could only communicate with us on social media in English. Now we're also communicating with them in Spanish, and hope to be able to roll that out into other languages as well. We've been able to increase our presence for outreach at faith-based institutions, schools, community organizations, which has really allowed us to be embedded in the community and to reach a more diverse population. And we can now also obviously fulfill requests beyond just English, and the fact that we're able to translate all of our vital documents, translate any information that's coming into the agency. Now, if somebody fills out a complaint in Spanish, it's increased our staff's capability, right? Before the utilization of these services and these contracts, it would fall upon the staff that was multilingual to have to translate some of these documents, and now that's no longer the case. We're able to, have a contractor, a vendor who can do that and help us to be able to respond in a much more cohesive manner, ensuring that the translations are the same, and uniform across the board, and also help with our staff, freeing up our staff time to be able to focus on the work at hand. We have at the agency 195 bilingual staff members that have raised their hand to say I'm bilingual. And obviously, in a staff of almost 4,000 that has to service upwards of 500,000 customers a year, that's just a drop in the bucket. And so this contract has really enabled our staff to have better service delivery for all New Yorkers. And then, of course, the use of VRI, video remote interpretation services, has increased accessibility for deaf and hard of hearing, for individuals who are deaf and hard of hearing, and increased our ability to provide services within that community. And just overall enhance the availability of our documents and of the information that we are providing to the community.
Great, thank you, Melissa. And for Jenny, Jeanette, and Melissa, is there a phone number, email, or website for someone whose preferred language isn't English to reach your agency for questions about your services?
I guess I can start, and on our website and on state agencies' websites, there's a language access icon, and it is prominently featured as a header on our website. And if an individual hovers over that header, they'll have the option to translate our website into the top 12 languages. And we have a call center at the Department of State. The call center responds to calls for the Division of Licensing, the Division of Consumer Protection, and corporations. Staff of our call center are trained on how to access telephonic interpretation. We can provide telephonic interpretation into 190 different languages. And our frontline customer serving staff, so anyone that receives calls from the public, they're all trained on how to access telephonic interpretation, how to report any calls that have been dropped, any interpreters that are not able to stay on the line, or any deficiencies, really, back to us through a centralized SharePoint site. And for emails, again, if a person were to email any shared mailbox in a language other than English, they would send that to the Language Access Program for translation into English to understand the nature of the email, and then we would send our communication into the language spoken by the constituent. So we would translate our communication back into that language.
So to piggyback off of what Jenny said, our website as well is available into the top 12 languages. As I mentioned, we have a 24/7 free anonymous Hope line, which people can reach, and it's on our website. It's on all of our campaigns. We have the number along with the text. And for texting, all you have to do is text Hope New York. And they will respond to you in the top 12 languages as well. They use Language Line, which offers over 140 other languages that can be interpreted. As I mentioned, our webpage, we have a language access webpage that has all our vital forms that are translated as well. Interagency-wise, in order for our staff to utilize the vendor, to get access to the vendor, to get translation services for our clients, we have that information set up on our intranet page. And Advan page, who does our over-the-phone set of pins for all our ATCs. So, which makes the billing process also easier for me because I get to see which ATC utilized what services. And as well, that service is available for our administrative offices as well as our service offices.
And then I'll piggyback. Our website, dol.ny.gov, is also translated into top 12 languages. You can reach our contact center, which provides help in various languages, by phone, 518-457-9000, or 888-469-7365. The easy way to remember it is 888-4-NYS-DOL. If calling via TDD or TTY, you would use 800-662-1220 or 711. If you're in the New York City area, dial 211. And then you can also try and contact our language access coordinator directly by phone at 518-457-1984. If trying to call via TDD or TTY, 800-662-1220, or you can email languageaccess@labor.ny.gov, and our language access coordinator's name is Jason Gibson.
Great, thank you all. And just one more question for the three of you, and we can go Melissa, Jeanette, and Jenny. Do you have a set budget to pay for language services, or how do you get funding for this?
So Jeanette and I were actually talking about this a little bit earlier before the panel. There's not a set line item budget. I think that through the years of providing language access services and data collection that we've been doing at the Department of Labor, we've developed a comprehensive approach to be able to be flexible and to fulfill the needs of any requests that come in. So our financial management process really involves a close collaboration between the finance department and our contracts and procurement department, so that when language access services are required, finance works really closely with them to ensure that there's adequate funding that gets allocated to any purchase orders. And this really allows us to be flexible and to be proactive in our approach to promptly process and pay any invoices that are received. We estimate that based on our current projections and historical usage patterns, that the annual expenditure is going to be approximately around $2 million for essential language access services at the Department of Labor.
Yeah, and to piggyback off of what Melissa said, I myself, as I think, Carol, you had mentioned, we have to put in those PRs. I'm also grateful that the Office of Language Access has us do an annual monitoring report, which breaks down the amount of money we spent on written, over the phone, and in person. And that helps me make an assessment when my fiscal colleagues are saying to me, Jeanette, it's that time of year, we need for you to tell us how much we're going to spend on written, how much we're going to spend on over the phone, how much we're going to spend on American Sign Language. I have a better estimate based on what we spent the year before. I'm happy to say, as I had mentioned earlier, that we had an increase in the over the phone and in person, which means that I believe we're reaching more vulnerable New Yorkers who speak different languages and American Sign Language. Our cost isn't close to $2 million yet. I'm hoping we get there one day, Melissa, because that means we're reaching more people. But as of right now, we're almost over 300,000, which would include over the phone and written translation and in person. I would say our biggest cost is in person, because again, we have a lot of group settings for the people that come into our programs. And we try really hard not to have a family member or anyone else really be an interpreter, because we want them to have the best services and care. So it's essential that we have a vendor, that we have someone there that is culturally competent, and that, you know, can understand our setting and our clients and patients.
So for the Department of State, we work very closely with the fiscal division to complete purchase requisitions for services, to assess what it is that we will have as our expected spending for the year. Similar to what Jeanette said, I go through the same exercise of finding out what we spent the last year and giving fiscal a heads up that we expect a similar amount. And working hand in hand with fiscal for the requests for quotes, for payment of invoices, for communication with vendors that may be more responsive to our needs. But we don't have a set budget, but we do have the flexibility to be responsive to growing needs. And I say this because we had to, during the pandemic, rethink how to deliver services, and we really acted really quickly, and our hearings became virtual. We needed to work with our fiscal team to think through how to make our virtual interpretation more responsive. We used to have it on a phone as an app, and then we needed to figure out how to use it through WebEx. So really our fiscal team thinking through new requests for quotes. You can't have more than one virtual interpretation vendor for a specific type of service. So we work really closely with fiscal to respond to our needs.
Great. Thank you again, Melissa, Jeanette, and Jenny. For the next question, we have Laura. How long does the process to become an authorized user typically take?
It may be shorter or longer than this depending on the individual request, but in general, we advise that it may take around 7 to 10 business days to complete that process.
Great, thank you. And for Carol, are there resources or guidance available for authorized users on how to use the services under the contract?
If you go to the contract's main page, there's a how to use and a frequently asked questions. Right there, there's a link, and that'll walk you through some of the basics. There's another really important section, which is difficult to find, but it's in the actual base contract. So if you were to click on base contract information, then solicitation documentation, it's section 6.3, the procurement instructions. Reading through that section, it'll lead you through how to do the request for quote RFQ. You have to send that out to all of the authorized vendors for the title and the region. And then once you get the bids back, then you would make your selection, choose an award, and then issue a PO and start services. If you are a BSC customer, the OGS Buy Desk can actually do that on your behalf.
Great, thank you, Carol. Now our last question before we open it up to the audience is for Jenny, Jeanette, Melissa, and Carol. What do you wish organizations like yours knew about this contract and services?
So I work for the New York State Office for New Americans within the Department of State. And we have organizations that we provide funding, community-based organizations that are newer, that may not have the infrastructure to have thought about how to develop a language access plan, may not know what vendors are available, how to request quotes, or how to identify vendors with specific language needs. We see arrivals that require languages specific to West Africa that might be more difficult for vendors to have on hand. So having this contract is such a value add for organizations that are part of our, we call it ONA, Office for New Americans Network, because it does the part of vetting. It vets organizations. It offers community-based organizations a lower rate because it's already been negotiated. It allows us that piece of not having to do just a search for vendors. It's already there, and the rates are negotiated, and that piece has been done. So it's such a huge value add for our network. So we're really grateful for that. And as for my work at the Department of State more generally, we're a big agency described as a filing cabinet. I've heard it described as a junk drawer. We have a little bit of everything. And I go back to that liaison model. We can provide services across such an array of different missions because we have liaisons that provide us a feedback mechanism loop, right? We're there to train them about the importance, about how, and then they are there delivering the services because we can't physically be at every boxing match, MMA match, administrative hearing, ONA outreach presentation. So we're really grateful for that liaison model and for having the opportunity to have leadership from OLA now that, to bring those resources back to all the different divisions. So having this contract allows us to focus on the training. So we're not focused on identifying vendors, finding that piece. We're identifying on issuing requests for quotes on specific needs that respond to what our liaisons are telling us are opportunities to strengthen delivery. So we're grateful that we have taken that out of our scope of work. So having that centralized contract is such a benefit to the language access program at the Department of State.
Great, thank you, Jenny. Jeanette?
Yeah, so I would say it's wonderful to have this centralized contract, and also, kudos to the Office of Language Access, Margarita and the team, and OGS for expanding the list, because I know there was a point where we had just a certain amount of resources. And I think the expansion of having more organizations provide language access services and ASL is important to all of us. Obviously, at the New York State Office of Addiction Services and Supports, offering culturally and linguistics appropriate and tailored resources help us increase our services to those who need it the most. I would tell you our 12 addiction treatment centers have bilingual staff. Our ATC, Kingsborough in New York City, utilizes their bilingual staff, but they're very grateful to have these other resources. And as Melissa had mentioned too, we're beginning to start to do video remote because we also know that there's geographical challenges, right? So in the city, there may be services that are a lot more centralized, and upstate, not so much. So it's very difficult at times to get those in-person services in upstate New York. So with a VRI option, at least you can access so someone doesn't walk away from our programs when they need it the most. I'm very grateful that this contract is in place. I'm very grateful that there's, more vendors to choose from. I see more companies that provide language access services that come to us and say, hey, how can we help you? How can we help get your campaigns or your marketing or your documents, or in what capacity can we help get out this message to help you let different cultures know about addiction? And as I mentioned before, we know cultural competence is important in these conversations. You want to be inclusive to everyone. And just because you translate a message doesn't mean it's going to reach everyone you need it to reach. So it's important to have the expertise that a lot of these vendors provide, that cultural competence, that language that some of our agencies are specific about. We're one of those agencies in the healthcare field, and there's some certain lingual, languages that we use, certain words that, again, you have to have that cultural competency to be able to explain it to a person. So they're not afraid, and they understand what's actually being presented to them. So again, I'm grateful for this contract. I think it does a lot of good for many agencies, including ourselves, and it saves a lot of lives.
Thank you, Jeanette. And Melissa?
So I think the first thing really that I want organizations to be aware of, right, is that the contracts exist in the first place, and to help get the word out about that they don't cost anything for individuals who have limited English proficiency, and that this is a contract that we all want our staff and we train our staff on to be able to utilize and offer these services to all New Yorkers. I think that we all agree here at this table and in this room that language access is crucial. It's a crucial service, especially for government services, and something to be able to provide. And these contracts enable us to be able to do that, utilizing a variety of methods, from in-person interpretation to telephonic services to document translation to VRI services. Really helps our organizations to be able to meet the needs of all New Yorkers, and ensures that we're able to be fluid in how we deliver those services and in the preferred mode of communication and preferred language for individuals that are coming to receive services from our organizations and our agencies. I think it's also important to remember that regular staff training is really vital to be able, for the success of these, of these contracts and these services, having a really good and really fluid language access plan that's regularly looked at, which the Office of Language Access has been so vital in helping all state agencies to be able to keep on top of, and to have like a really focus on improvement. And then, of course, I think to remember that this is always a work in progress, and so we have to remain flexible and responsive to changing language needs.
Thank you, Melissa. And Carol?
We have a little bit of a different perspective of the use of the contract, because at the Business Services Center, we're helping the state agencies actually procure the services. Our advice is a little bit more specific to the procurement process. And some of the things that I wish some of the state agencies knew would be like, when you're actually soliciting the vendors, make sure that you know what your specific need is. We work with a lot of smaller agencies, and lots of times the people who are requesting services don't really understand what the need is. There might be a big difference between just having a regular ASL interpreter and having a deaf-blind interpreter. Do you have somebody that, you use a lot of medical jargon or legal jargon? You may need a specialized interpreter to translate for those specific needs. If you have maybe a long-term patient who would benefit from having a one-on-one interpreter, same person every day for their entire stay at a residential facility, as opposed to just any random interpreter that happens to be available. So there are very different needs throughout the state. All agencies have very specific needs based on the services that they provide. So you really need to drill down and work with your language access coordinator and find out what your agency's needs are and express that to the vendors so that they can bid appropriately and provide you with the specific services that you need. We also recommend setting up services for the full 2-year term that's allowed by the contract, because you may have things come up on an as-needed basis. You might not have a need where it's constant. And if you randomly have someone come in you've got a patient that comes in who doesn't speak English, you may not have time to go out and do a solicitation. You want to have those services already set up. You want to have an agreement with a vendor in place so you can immediately call up that vendor and say, hey, we need somebody for this language. It's just overall, you'll have more bids, it'll be cheaper rates with more competition, less work in procuring the services, and you'll be able to actually obtain the services that you need faster. It's also, this contract is what is considered a best value contract. It's not automatically awarded to the vendor with the lowest price. And that is very important because you want to really look at the different vendors, the services that they provide, the relationship maybe your agency has had in the past with those vendors, because it is so specialized. You want to make sure that you are getting the vendor that's going to provide the best services, not just the cheapest. The cheapest option isn't always the one that's going to best suit your particular needs. Also, an important thing is having a purchase order for state agencies, having a purchase order in place before you go requesting services. If you're doing large spends, it has to go through budget approval. It has to go through Office of State Comptroller. They need to approve things, and it can take a while. So you want to make sure to plan your procurements accordingly. And again, if you can, set it up for the full 2-year service so that you're not scrambling if you have an immediate need. There are provisions for immediate needs if that's something that, obviously emergencies come up, but we try and avoid that as much as possible. And then there's lots of other minor things. This contract allows multiple awards to be made. You can award multiple vendors. So you have a primary vendor and a secondary vendor. So you have a backup. Maybe one vendor isn't able to provide your needed services on a particular day. There could be technical problems. You've got a backup, and you can go directly to that other backup vendor. You can also negotiate the rates with the vendors. There are not to exceed rates on the contract currently, and then you do a request for quote where the vendors come and bid even lower. But even once you get those bids, the contract does allow you to go back and negotiate further with the vendors to get the best value possible. The worst they can do is say no. But we do encourage agencies to reach out and try and get the lowest price possible. For continuous services, you want to make sure that you've got a new solicitation done before the old one expires so you don't have a gap in services. Review invoices carefully. That's something that once the procurement is actually done and you're getting billed by vendors, people are human, they make mistakes. There could be all sorts of errors on the actual invoices, and you want to make sure that you're getting what you're paying for. And lastly, I just wanted to say, provide feedback. It would be great, as Jeanette mentioned, expanding the number of vendors that we have on the contract. In order to do that, if you can reach out to procurement services, the contract managers, and let them know if there's something within the contract that isn't there that you need, or if maybe you're having a bad experience with a particular vendor. That's feedback that OGS as a whole needs to have so that we can continue to refine the OGS contracts and make them better going forward.
Great, thank you, Carol, and all panelists for the insightful responses. Please, audience, help join me in giving a round of applause for our great panelists. So now we'll jump to any questions from the audience.
Just wondering how to handle this situation. We are right now trying to do an agency-specific contract because we did do an RFQ that failed. It's a unique dialect from, I believe, Chinese region that is needed for a patient. We cannot do VRI because it's a secure facility. And we did get bids on it, but it turned out only one of the vendors that bid could actually provide that language. And the interpreter was not willing to provide the required vaccination information for going into a patient population. So we were not able to use them. Meanwhile, the program did find a vendor not on contract that was able to meet their needs. So we are doing an agency contract. Just wondering if you have any other suggestions of how to do this, how to handle the situation, both in this unique situation as well as other similar situations.
When you're talking about going down the order of precedence, if the OGS centralized contract doesn't meet your form, function, and utility, you end up having to do any kind of open market or agency-specific procurement. And then all of the guidelines are going to be applicable to that very specific. It's not a great situation to be in. But yeah, we do recommend that if that's your need, then you need to go forward that way. If it's going to be over a certain amount, you do have to have an agency-specific contract. It's not just going to be your regular discretionary. And then that's all. Most agencies have guidelines for those specific procurements.
So just keep going the way we are and
Yeah, exactly. And it's after time, like you find that that's a need that you continually have. I know that it's a very specific language. That might be feedback that you can reach out to procurement services on and let them know, hey, this is something that we're not finding coverage for under the OGS centralized contract. And maybe we could do something to solicit more vendors on the next round for the contract to make sure that we get those languages covered.
thank you so much.
Can I just add something to that? So I would say too, I think some of us have gone through that as well. So I know with some of, I mentioned with our upstate addiction treatment centers, there's been certain languages that are not the top 12. And I know that some of my ATCs have also worked with some community-based organizations until we could, work things out with finance and kind of, see what else was available through the contract. Just another option. If you need something right away, CBOs have also been very good to us.
We've been through similar situations, and I know for us, until we identify a vendor that has the ability to fill that language, we use telephonic interpretation to communicate and reschedule and all of that. But when we do issue requests for quotes, we include indigenous languages that we're seeing a higher frequency. So you can include, what is your fill rate for that language, or how many interpreters do you have in that language? So that way that you can already plan ahead, that they are not going to be able to comply. And we're seeing, as I mentioned, more requests for West African languages within our network. So we're aware of that trend, and we're being proactive about getting that information.
Yeah, it's hard to determine different dialects because, outside of the top 12, we're not limited. That's the great thing, is that OGS works with us. We're not limited to just that, but it may take some time, to find it.
I'm curious if you're experimenting at all with AI to do translations of video, like this video recording, being able to translate that into other languages, or using AI to do live interpretation of audio?
Well, I would say, when we've done campaigns, my only always concern about AI is the cultural competence. I think it's a great tool. I think we definitely do utilize it. I know for translating some of our website and, for our ATC offices, some of them actually carry mobile, translators as well when they're in the field, as do our regional field office. So we do utilize it, But again, I'm just very cautious at times of that cultural competence aspect.
We've utilized it. We have a chatbot on our website that we call Perkins, and it's at its most basic level AI. And so we utilize it for that, and it does translate into a variety of different languages. I would say very loosely, we are beta testing. We are playing around and seeing about AI translations of videos, but I don't think for some of the reasons laid out and some of the parameters that we try to stick to in terms of the confidence of the translation, I don't know that we're at a point where we would feel comfortable in putting that out publicly, but we're definitely looking at it and seeing what's available.
Just to comment on that, one of the things around the culture, you can train these AIs,
Yeah.
based on certain personalities, certain language styles.
And we've played around, like the different dialects. Some of our beta testing, we've played around with, for Spanish, for example, many different dialects depending on what country you're from. And so we've tested training it if you're speaking to someone who's from Puerto Rico versus you're speaking to someone who's from Mexico versus Colombia. And so, we are looking at it. I just would not say that we're at a place now that we can say we're going to, that can replace a human being at this point in time.
Yeah, and I just quickly want to add, thank you for that question, Harold. The focus of this session, the Language Services Contract, has the focus on human linguists. When it comes to AI, we definitely also want to be careful whenever agencies need decision-making, right? When decision-making is involved, especially in a legal or healthcare setting, right? We want to make sure the human linguists are being used and that the staff member is using those resources for those cases. And AI can definitely be a helpful tool to supplement the use of human linguists, especially in those cases.
Hi, I work for tax and finance, and I'm just curious, can you just explain how or why OGS arrived at a maximum RFQ period of 24 months? Tax would desire to have longer ones, but I'm just curious why it is that they're 24 instead of the full 5 or however long the contract is.
Working on it before Laura came. So the reason we did 24 months is because we had major feedback in regards to temp employees being paid the same rate for 2 years and not, when they wanted to be able to give them raises or something, just like we all get. So that's the reason for the 24 months. It was just so the rates could potentially go up for temporary personnel.
Great, so thank you all again for joining us, and please help us give a final round of applause for our panelists.